Welcome to our Fertility 101 event. I am Rebecca with Kindbody. I'm going to be hosting the event and helping to get all of your questions answered. And then Dr. Fahimeh Sasan, the founding physician of Kindbody, will be going over all the details, fertility facts, and fundamentals. We have Megan from Kindbody here who can wave, who's going to be helping in the chat as well. So we're going to go over quite a bit of information, and we really want this to be interactive. So we encourage everyone to ask any questions you have in the chat, and we will either answer them during the event or at the end. So the chat is open. If you could all tell us where you're from, that's always a fun way to start things off. And then I'm going to pass it off to Dr. Sasan, who will tell us all sorts of great things about fertility.
Awesome. Rebecca, are you ready for me to start?
Yeah, go ahead.
Okay, great. Hi, everyone. I'm Dr. Fahimeh Sasan. Thank you for the introduction. I'm so happy to have you guys. You know, I am a social person, and so we normally used to do these in person, so I miss seeing everyone's faces. But so glad that we can reach out and still disseminate this really important information. First and foremost, on behalf of our entire Kindbody team, we hope that you and your families have been healthy and safe during these crazy times, and we hope that the next hour gives you is informative and gives you hopefully a little escape from some of the scary things going on in our world right now. And definitely we'll leave lots of room at the end for questions, and welcome you guys to reach out to us now or separately if you don't want to in the forum, but we're here to answer all of your questions. So without any further ado, this is Fertility 101, and we're going to dive in deep about reproductive health and women's health and just some fertility facts that I think unfortunately a lot of us don't know. So our mission at Kindbody is to make women's health and fertility modern, welcoming, and accessible. And what we mean by that is that I recognize as a woman and as a physician that women's health can often be scary. You know, nobody likes going for their annual pap smear. And then certainly when we start thinking about having a family, it's kind of something we talk about behind closed doors. And a lot of times it's an area that it's supposed to be really exciting and happy thoughts of having a family and all of those things. But a lot of times it can be frustrating and anxiety provoking, especially if maybe you're not quite in the place that you thought you would be ready to have kids, or maybe you don't want to have kids now, you would like to have them in the future. And it's definitely something that our society puts a lot of pressure on women for. And so our goal at Kindbody is to really help empower women with information and options so that you can make the right decisions for yourself and so that you can make the right choices. And by having the knowledge, then you can just go forth without any fear and live your life to the fullest and have the family of your dreams. And we really do think that all of those things are possible. So what we do the entire array of fertility care. So from fertility assessments, so that's just if you're just curious to learn more about your body and your fertility, to actual egg freezing and embryo freezing and intrauterine insemination and in vitro fertilization. And I know these are words that a lot of times we've heard, but we don't actually know what they are. So we'll talk about those. But we do the entire spectrum of fertility care. We also do full on-suite of gynecologic services, so just your regular checkup, your pap smear, IUDs, contraception, whatever the case may be. So we're here for you from everything gynecologic as well. And then we realize that you can't just take care of a woman's uterus and ovaries and call it a day. And so we want to also be the place that you go for wellness and nutrition. And we know mental health plays such an important role in our wellness. We also do LGBTQ services, so maybe you're a same-sex couple that's interested in achieving pregnancy and wanting to know exactly how to go about that. And then also can help with donor egg or sperm and surrogacy as well. So we really are hoping to end the fragmentation that currently exists in the fertility world and in the women's health world, and wanting to really provide all of that for you under the same roof in a comfortable environment. So what are some updates? Well, gosh, everywhere around us, things are closed. I don't know, I know a lot of you guys are from New York, but New York is starting to wake up a little bit, but it's kind of sad when you walk through the streets. I was on Fifth Avenue earlier today, and so many places are closed and like moved out completely. And so I know it's kind of a crazy time, but we know that our health is so vitally important. And, at the beginning, it was like, okay, things are going to be shut down for a couple weeks, maybe a couple months. But now that we're going on the 4th month, we just really want to remind women not to ignore your health. So maybe you put off getting your annual checkup this year. Maybe you put off your pap smear this year. Maybe you were intending on starting a family, but you decided to delay your start. We just want to remind how critically important it is for us to take care of ourselves, and that our wellness is so vitally important. And especially when it comes to fertility, time is so important. And so we're here, we're open, we're taking extreme precautions to help protect you and our staff from COVID-19. And we promise you that you'll be in good hands when you're here with us in the office or virtually. So why does this matter? One of the most important aspects of all of this is to realize that we kind of spend our entire lives trying desperately not to get pregnant. And so when it finally comes time to saying, okay, I'm thinking about having a family, we're kind of stuck, like, oh gosh, where do I begin? What am I supposed to do? And so the goal of this talk for the next few moments is to kind of make that right, and just to talk about some of the basic fundamentals of reproductive health, and so that we really set things straight for that lack of knowledge that a lot of us have. So when it comes to fertility, the most important thing is age. And I'm sorry to break it to you ladies, but it's true. So when our, favorite aunts or our mom nag us about our age, it actually is a real thing. And the reason for that is that as women, we're born with all the eggs we'll ever have. So on average, women are born with about 2 million eggs at birth. And by the time we reach our first period, our very first period, we're already down to 300 to 400,000 eggs. I hope your jaws are dropping, because it's ridiculous and so unfair, but it's the truth. And then from there, so think about when you had your first period, maybe you were somewhere between 9 and 14, maybe you were a little older, maybe you were a little younger. But since our early teens, we've lost up to 1,000 eggs a month. So we start with 2 million, down to 300 to 400,000 by our first period, and then we're losing up to 1,000 eggs a month. So that the fact of the matter is, regardless of how healthy you are, how much you take care of yourself, how stress-free your life is, or whatever the case may be, all women with time will reach a point where they have 0 eggs. And that, if you hear nothing more of this, is just understanding that this isn't something we can cheat the system. And it's not something that we can prevent this stop. There's no medicine or magic drug or fertility treatment I can give someone once they reach that low egg count to make them have more eggs. It's a really important part of this whole conversation. So why does age matter so much? Well, I just talked to you about how when we're born with all the eggs we'll ever have. And so then people often say, well, till what age am I good? So a lot of times we hear 35, and that's true. A majority of women will have good fertility up until the age of 35. But the key thing to understand is it's not that you're perfect, and then you turn 35, and on your 35th birthday, you suddenly have diminished fertility. It's a decline that's really starting from birth. And then kind of the scary part of it is that 1 out of 10 women, so it's a lot, 1 out of 10 women can actually have premature ovarian failure or premature diminished egg count before the age of 35. So we can't just assume because we're 30 that our fertility is perfect, and we can't just assume because we're 38 that our fertility is poor. You can kind of be on either end of the spectrum, and so then it becomes really important to say, okay, let me find out my real truth, let me find out my facts, instead of just assuming that I'm good or bad based on my age. So age is important, time definitely matters, but you can't always just assume that you're good or bad because of your age. So what's another aspect that changes with our eggs? That's the quality. So our egg count declines with age. We just talked about that. But the other thing is our egg quality. So this is a really nice kind of depiction here. So at birth, we have 1.5 to 2 million eggs, and 100% of our eggs are normal. because they're normal. Because at birth, they're brand new, these cells are normal. So the quality, meaning those 23 chromosomes that make up an egg cell, we can assume that probably 100% is a little much, but 99.9% of our eggs are normal at birth. And then as we age, we lose eggs, so we just talked about that, but our egg quality also declines. So that by the age of 40, only about 3% of our eggs are going to be genetically normal. So even a 40-year-old has some genetically normal eggs, just the same way as even someone who's 30 will have some genetically abnormal eggs, okay? And so the take-home message for this is to understand that our egg quality also declines with age, okay? So what's the reality, or what's my take-home message to you is you're never too young or too old to learn more about your fertility and to know your options, right? And same way I just talked to you about, don't assume that just because you're 40, you don't have any options, because some 40-year-olds are still fertile and have plenty of options. And then to not assume because you're 30 that your fertility is great, because unfortunately some 30-year-olds have poor fertility. So the key is, let's just empower ourselves with the facts, the same way we go to the dentist and we go to the eye doctor to check on our teeth and eyes. Let's go to Kindbody and check on your fertility. And that information can really then be powerful. So, when are we most fertile? Let's just go down to kind of some basics of our fertile window, right? So I talked to you at the beginning about how we spend our entire lives trying to not get pregnant. So when is it that we can actually get pregnant? So this, what might be surprising for many of you is that we're only really fertile for about 5 days a month. So 72 hours a month is our fertile window. The rest of the time, you can't get, the likelihood of getting pregnant is really very small. So on this May calendar example, on Friday, May 1st, is when a period started. So that dot represents the first day of a period. And so then in this scenario, the fertile window would be day 10 through 14th of the month, right? So that during those times is when you're most likely to conceive. So when someone's trying to get pregnant and they have a regular cycle, the key is your periods have to be dependable, meaning you get your periods every 28 days or every 30 days. The only way this works, this algorithm would work, or this predictive model would work, is if you have regular periods. If your periods are irregular, then you can't use this as a system of tracking. But in someone who has regular periods, then having sex during the 10th to 14th of this example would be their most fertile time. And then recognizing, too, that sperm can live in our pelvic system for up to 5 days. So really, you could have sex on the 5th through the 9th of this example and get pregnant on the 10th. That's kind of cool thought process, too. So some people will use this in having sex extra on these days to try to get pregnant. And you can also conversely use it and by avoiding sex on these days to try to prevent pregnancy. So people who use the rhythm method are preventing pregnancy by avoiding sex on those days. How does ovulation work? So let's talk about that. What is ovulation? So I like to use my tissue box analogy. So this tissue box represents both our ovaries, and at birth we are born with a full tissue box of eggs, right? So at birth you have all the eggs that you'll ever have. So this is your right ovary and left ovary in this box. When each month our body then recruits a group of eggs or recruits a set of eggs to start growing and maturing. The eggs that grow and mature, their goal is to achieve a pregnancy, right? And then our brain sends a signal to this batch to help one egg fully mature. And this one fully mature egg is the only egg that has the potential of becoming a baby. So that's ovulation, is the process of one egg fully maturing and being released so that if someone is not having protected sex, the sperm would be able to meet this egg and create a pregnancy. And this egg is only available to us in our fertile window. So it's there for 5 days, at which point the sperm could meet it and create a pregnancy. And if someone is not getting pregnant or they're not pregnant, then this one mature egg is lost. All of these eggs that were recruited are lost, and the next month we go back to our tissue box, back to our ovaries, and recruit a new batch of eggs. And that cycle continues for the duration of your reproductive life. So that's how that works. Hopefully that was helpful. And so what are some factors that can affect fertility, right? So we talked about age, obviously the most important, but there's some other factors that are important too. Diet and lifestyle are so vitally important. And so I really encourage all of us to kind of always, whether you're trying to get pregnant or not, to kind of be the best version of ourselves. Really important, you know, not saying that you shouldn't eat junk food. Everyone needs a treat sometimes, and that it's okay to have alcohol in moderation. But just to remember that all of these things are really important and that they continue to impact us, because our health and our whole system is all connected. One key thing, lifestyle-wise, is smoking cigarettes. Smoking cigarettes has been proven to harm egg count and to also harm sperm count. So if you or your partner still smoke, hopefully you have a million reasons to not smoke, but I'll add one in that it actually diminishes egg and sperm count. The other thing that's really important is family history. So in particular, a lot of times people will come to me and they'll say, oh, Dr. Sasan, my mom had me when she was 43, or my aunt so-and-so had a baby when she was in her 40s, so I'm not worried. And unfortunately, it's great for your mom or your aunt, but it doesn't necessarily translate to you. Well, one thing that is important is knowing how old was your mom when she stopped getting her periods, meaning how old was your mom when she went through natural menopause. It doesn't count if your mom had surgery for some reason, so I'm talking about naturally stopped getting her periods. And if your mom was under the age of 45 when she stopped getting her periods, that sends off kind of a light for me in that I want to investigate, are you at risk for also going into early menopause? Because women who go through early menopause, their fertility is going to decline much faster, and their ability to get pregnant is going to be more difficult as they age. And then mental health, I can't stress mental health, and I think now is more important than ever, but our mental health, our stress levels really play such a big role in just our general health, our ability to conceive, our ability to have a healthy pregnancy, and then certainly our ability to take care of a newborn and into adulthood. So it's so important to address all of these. We have nutritionists and mental health therapists here at Kindbody. You can actually schedule appointments with them directly through our website. So we really are here to take care of you as a whole. So what is kind of the take home is that there's really understanding that everyone is different, right? And there's no way to just talk to a person and know whether or not they're fertile. There's no way to say, oh yeah, well, I take really good care of myself, I do yoga, I eat well, I exercise, so I'm fertile. There's just no way to know. And so we need some concrete facts of egg count and ovarian reserve to be able to tell you what your fertility is like. And so that's what will be the focus of the next few slides. All right, so how do you do a fertility assessment? Okay, so first it starts off with some talking. A one-on-one consultation. We do them in Kindbody with physicians here. And we can do that virtually or in the clinic. So some people are not in their normal homes right now. They're visiting friends or family or relatives or kind of hibernating away from the city. And so we can do that virtually or in the clinic. But it's a thorough discussion about your medical health, your medications, your social history, your periods, what are your cycles like, what medicines do you take, the whole spectrum, right? And a real honest discussion about what are your hopes and dreams, when do you want to have kids, do you want to have kids, have you already been trying for a year, what have you tried, what haven't you tried? So really getting deep about your family planning goals. So that's the first part. And then if you're in the clinic on that very same day, we do a vaginal ultrasound and some blood work. If you do this appointment virtually, then we would set up for you to come in separately to do parts 2 and 3. All right, so what do we find out on the ultrasound? All right, so going back to my analogy, we're born with all the eggs that we'll ever have within our ovaries. Just like you can't tell how many eggs or how many tissues are in this tissue box. Just by looking on an ultrasound, I can't tell how many eggs are in your ovaries. So we can get an idea of how many eggs you have, how full is your tissue box with this blood test called anti-Müllerian hormone, or AMH. So AMH gives us an idea of how many eggs you have left from the 2 million you were born with. So that's an important piece. And then the second is, remember I mentioned that each month your body recruits a group of eggs? Well, when we do an ultrasound, this group of eggs that were recruited each month, they're no longer microscopic. They are grown, they've been recruited, they're bigger, so they're visible on ultrasound. So when we do an ultrasound, we can actually count how many eggs your body has recruited in that given month. And that number, which is called the follicle count, combined with the hormone test that tells me how many eggs you have left from that 2 million you were born with, is how I can then tell you, without being hypothetical, how fertile you are. So is your fertility great? Is your fertility kind of middle of the road? Is your fertility low? And what are the implications of that based on your age and your family planning goals? And then to kind of take it a step further, it's one thing for me to tell you the information, but we also want you to have it at your fingertips. So once you have your test results done, you'll have your own patient portal where you can see your results and a really thorough explanation of the results. So then you can share it with your friends or family or your partner and be able to talk about it without having to remember, what did the doctor tell me? And so we find that portal is really helpful. And you can also chat with your doctor directly through the portal and ask questions. So the technology side of Kindbody is really trying to bring together the patient and the doctor so that you're kind of both on the same page and able to communicate, not just 9 to 5 in the doctor's office, but 24 hours a day. So what are the options? So you just came in, you did your fertility assessment, you found out your egg count is average, let's say, and let's say you're not ready to have kids now. Maybe you want to have kids in 10 years. Well, we can talk about egg freezing, right? As an option, saying, all right, your fertility is whatever it is today, but you want to preserve your fertility because you're not quite ready to have a family now, but you would like to in the future. So egg freezing becomes really helpful in that scenario. Alternatively, maybe you are in a relationship and you have a partner and you guys definitely want to have kids together. Maybe you want to have kids, but you actually would like to have 4 or 5 kids, and you're thinking about your 4th or 5th kid, and you want to freeze some embryos, either to delay childbearing completely or in preparation for having that big family that you desire. In that case, we can actually make embryos. What's the difference between egg and embryo freezing? Well, an embryo is actually a fertilized egg. So in that case, you're taking the egg and the sperm, putting them together and creating an embryo. Or maybe you are actually trying to get pregnant. You've been trying for a year. You've been trying for several years. Then we can talk about fertility treatments to actually help you conceive. So do you need an intrauterine insemination, meaning we just need to help you along by putting the sperm in the uterus? Or do we need to do full-blown IVF? And the key thing to understand about fertility treatments is not one size fits all. A lot of people sometimes have this misconception that if you're having difficulty getting pregnant, the only solution is IVF. And one of the things we really pride ourselves at Kindbody is walking you through your options and then being a partner in the conversation and saying, what works best for you? Is IVF a little too invasive? You're not quite ready for that? Maybe IUI is an option, or just being honest and saying, listen, your only chances of getting pregnant are going to be with IVF. So really having an honest discussion, giving you your options, and then helping you make the decision that is the best for you and your life. What is egg freezing? So then egg freezing is a process where we're saying, okay, you just mentioned to me that each month my body recruits a group of eggs, and that each month all these eggs are going to be lost. I lose up to 1,000 eggs a month, and I'm not ready to have kids yet, so what am I going to do? So with egg freezing, we say, okay, we know you recruit a group of eggs each month, and we know that the brain causes one egg to fully mature each month, and that only a fully mature egg can become a baby, and then at the end of the month, all these guys are going to be lost, right? So what we say with egg freezing is, all right, let's give you the same hormone that helps this one egg mature, but help the entire batch mature together and extract them from your body and save them for you, freeze them for you before they're lost. So it's really a process of being opportunistic and saying, let's take a group of eggs that were recruited, mature them, and extract them from your body so that you can use them in the future, whether it's for your first baby or for your last baby. But the key thing to understand with egg freezing is we're not making new eggs, we're not making more eggs, we're not in any way altering the eggs. All we're doing is helping a group of eggs a woman has mature and then extracting them and saving them. And that's the key thing, is that if a person doesn't have a lot of eggs, if a woman's fertility is poor, we're not going to be able to make more eggs than what she had to start with. All right, so who should consider freezing eggs? Should you consider freezing eggs? I think the best thing to do is to really have a heart-to-heart with yourself. And I encourage any of you who have a partner, if you do have a partner, to ask yourself these questions independently and then share your answers with your partner. And the first question should be fairly easy. How old are you? The second question is, how many kids are in your ideal family? And be honest. Maybe it's 0, but maybe it's 3 or 4. And just be honest, like in your dream ideal family, how many children would you like to have? The third question is, how old will you realistically be when you have your first child? And it's really important to be honest. Not like what was in your childhood dreams, but realistically, how old will you be when you have your first child? And what impacts that? It might be your finances, it might be your career goals, it may be you're waiting to meet the right partner, it might be that all of the above, maybe you want to travel, whatever the case may be, but be realistic when you answer that question. And then the fourth question is, how old will you realistically be when you have your last child? Especially important if you want more than one child. And the reason that's important is pregnancy itself is 10 months, 40 weeks, right? And then the medical recommendation is to wait 1 year from the birth of a child to the start of the next pregnancy, meaning you wait to celebrate your baby's 1-year birthday before you start trying again. So in a person who wants to have more than 1 kid, you're pregnant for basically a year, 10 months, and the medical recommendation is to wait a year from birth of a child to start the next pregnancy. So that's 2 years at the bare minimum, right? And if you look around, most people aren't getting pregnant when they have a 12-month-old, right? It's hard, I'll tell you that as a mom. And so if you're waiting till you're 35 to have your first kid, by the time you're ready to have your second child, you're going to be at least 37, maybe 38. And then if you want to have a third baby, you're going to be in your 40s. And so that's why this is really important. If you're thinking you want to have one or all of your children after the age of 35, then definitely you should consider egg freezing, because it's going to help you improve your chances of having that ideal family. All right. So how does egg freezing work? We talked about this already. So basically just taking eggs, helping them mature, and then extracting them and saving them for you to use in the future. And we're being opportunistic. So some of the questions that people will ask is, if I freeze my eggs, is it going to make it harder for me to get pregnant naturally? And the answer to that is no. You could literally freeze your eggs in July and start trying to get pregnant in August. So it does not harm our ability to conceive naturally. It also does not cause cancer or any long-term health benefits, harms, and that's been really well studied, okay? And the whole thing is just, what we're doing is really mimicking what your body naturally does, but with a little extra oomph so that we can make more eggs mature simultaneously. All right, so how do the hormones work? And this is the same, if any of you out there are thinking about egg freezing, or if you're thinking about trying to get pregnant, the process is exactly the same for egg freezing and IVF, and I'll walk you through just a small difference, which is the actual getting pregnant part. So we're stimulating your ovaries over a 10-day period with injections to help your eggs mature. Again, these hormones are something your body sees every month naturally. The same hormone that helps that one egg mature, but we're trying to make more eggs mature. So the injections are over about a 10-day period, and they're helping your eggs mature. So we monitor you. We do ultrasound and blood work to monitor that maturation so that we can extract the eggs at the perfect time when they're perfectly mature. We don't want to extract them too early. If we take them out too early, they'll be immature and they're worthless. And if we wait too long, they'll be lost. So there's a really fine balance. That's why when you're going through an egg freezing process or even an IVF process, you come to the office every few days to be monitored. So here's an example of the timeline. So in this example, that stop sign represents if someone's is on birth control. If you're not, then ignore it. But if you're on birth control, you would stop your birth control. We would tell you in this example on Sunday. If you're not on birth control, that little symbol there represents the symbol on Wednesday. The yellow symbol represents the first day of a woman's period. So if you're not on birth control, we wait for your period to come on Wednesday in this example, and 2 days later, you would start your stimulation. So you're coming to see us every other day for blood work and ultrasound, or every 2 to 3 days, and you're giving yourself injections at night to help your eggs mature. And then if you see in this example, in that final 5 days, it says tentative egg retrieval. That one of those days would be the day your eggs are retrieved. Meaning that's the day we extract it out of your body. And why is it that it's a 5-day span? Because we have to wait for your eggs to mature, and every woman would respond differently. This is not cookie cutter where every person gets exactly the same thing. So that even if you and 10 of your friends all started on the exact same day, your finishing point will be different based on how your body responds, based on the perfect timing of your eggs reaching maturity. So that's why it says tentative. And this is just an example, but key points from this whole process only takes about 14 days maximum. So that's one of the biggest misconceptions. People think egg freezing takes many months. It's literally maximum 14 days from beginning to end, and only about 10 days of injections. So how does the retrieval work? The retrieval is the day where remember those eggs that we were maturing? We need to extract them out of your body so we can save them for you. That's a 10 to 15 minute procedure, that's all. It's done under a sedation, meaning you are under like a twilight sleep, not general anesthesia with like a tube down your throat, but just a twilight sleep, so you're not aware, so don't worry, it's not painful. And we put a very small needle through the vagina. Pretend this is an ovary. We go right up to the ovary, and we suck out the eggs with like a straw, basically. And the whole thing takes 10 to 15 minutes. We do have someone take you home that day, not because of the procedure, but because of the light anesthetic that we use. And you'll go home. Most people go home and watch TV or rest, read a book, and the next day you can go back to your normal activities. So, I know we're all busy and work, etc., but really only taking away from your normal activities for 1 day in this 14-day period. And then how many eggs should you freeze? So we just walked through what's the egg freezing process. And basically, if you're in your 20s and early 30s, we want 10 eggs for the improved chance of 1 baby. Okay, and why is that? Well, human, reproduction is not 1 + 1 = 2. I mean, it is, but it's not. In that, it's not a 1-to-1 ratio. Not every egg would become a baby. If that was the case, literally the human population would be trillions more than it is now. And so that 10-to-1 ratio incorporates that in any situation, some eggs just won't fertilize. Some eggs will fertilize but won't grow. Some eggs will fertilize and be genetically abnormal. So hopefully we get left with 1 genetically normal embryo. So then how many eggs should you freeze? Depends on how old you are and how many kids you want to have. So in a woman who's, let's say, in her early 30s, who wants to have 2 children someday, her goal would be to freeze 20 eggs, and so on and so forth. And we'll talk to you about the nuances depending on your personal desire, your ambitions, how old you are, how many you should freeze. The key thing to know is that I can't control how many eggs you get. Depends on how many eggs you bring to the table, right? We can only help your eggs mature. There's no way I can make you get more eggs than what you have. So that's where sometimes women may need to go through an egg freezing cycle more than once to achieve their goal. And I can, and if anybody has any questions about this topic, obviously we'll talk about it more in the Q&A section. All right, so next kind of natural step of this, and often people ask, well, I've heard embryo freezing that is better. What's the situation, etc. And so the bottom line is there was a period of time, I would say a little over 10 years ago, where embryo freezing was really the only option. And the reason for that was that we didn't have the technology to freeze and thaw eggs successfully. Embryos are more sturdy because it's an actual egg and sperm that have come together to create that embryo. And so there was a period of time where we just weren't good at egg freezing or thawing. But a lot of advances have been made, and now our technology is perfected egg freezing and thawing, so that now, whether someone has an egg or an embryo, the success is going to be the same. It's really just going to depend on how old was the woman when that egg was retrieved or that embryo was made, right? So the key factor between the difference between egg and embryo now becomes, the success is the same, it becomes how much information do you want to have at the time of the freezing. So in someone who's older or we're really worried about her egg quality, then we want to create an embryo because I can only genetically test an embryo. You can't genetically test an egg. But in someone who's younger, her egg quality we can presume is going to be good, so then she may just freeze eggs. So this is something we can talk more about one-on-one when you come to see us. But the bottom line is egg and embryo freezing are now equal success rates, and so that's amazing. And one of the other factors to keep in mind is when you create embryos, you're now fertilizing those eggs. So if you're not quite committed to the sperm source or the guy, then it would not be a good decision to make embryos with them, because once we fertilize an egg, we can't unfertilize it. So that's a really key thing to keep in mind. So what comes next, right? So your eggs, once they're either eggs or embryos, whichever you made, they'll be stored. And my hope really for anyone who freezes their eggs is I hope you never need them. I hope you're able to get pregnant when the time comes and you're ready on your own for free at home with sex, and we're done. But the reality is sometimes life doesn't happen the way that we plan. And so whether it's for your first baby or it's for your last baby, then you can come back and say, okay, you know, I'm trying to have my last baby, I'm now 40, and you take those eggs out at the time, fertilize them with your future partner's sperm or donor sperm, whatever the case may be, create an embryo, and then transfer the embryo back in your uterus to grow. So the fundamental difference between someone who's freezing their eggs and someone who's doing IVF is when does she want to be pregnant, right? If you're freezing eggs, you're saying, I'm preserving my fertility for the future. And someone who's doing IVF, they're saying, I want to fertilize these eggs today, I want to create an embryo, and I want you to put it back in my body, you know, within the next 2 to 4 weeks so that I can be pregnant now. But the process leading up to those eggs, to the fertilization is exactly the same. The main difference is when does she want to be pregnant? All right. And so this is what we just talked about. And the IVF process is the actual process of taking that egg, fertilizing it with sperm, creating an embryo, genetically testing that embryo to make sure it's normal, and then putting the embryo back in the uterus to grow. That is IVF. And not all people with fertility issues need IVF. And we'll talk to you about who needs IVF on a one-on-one basis. But a lot of times it may be just that you haven't been having sex during your fertile window, or maybe there's an issue with sperm where we need to get the sperm to the top of the uterus to help with fertilization. Okay? So what does it mean to be infertile? There's some definitions. So infertility is defined by 2 things. It's one is that by definition you have been actively having unprotected sex, and you are under the age of 35, you've been having unprotected sex for 1 full year and have not achieved a pregnancy. Or you're over the age of 35 and you've been having unprotected sex for 6 months and have not achieved a pregnancy. Okay, so those are the definitions. And 1 out of 8 couples, regardless of their age, will have infertility issues. And 1/3 of infertile couples is actually related to the man. So take-home messages. One is, I don't want you to wait a full year to find out that you had a problem you could have diagnosed a year before all this anxiety and heartache of trying for a year and not getting pregnant. So this is one thing I'm really passionate about, is I want men and women to learn about their fertility before they start trying, so that they can enter the path of trying with peace of mind. And we just spent all this time talking about how fertility is so dependent on age and time. And so I would hate for a couple, a third of couples have male issues they would never know, to go through this whole process of trying, whether it's for 6 months or a year, and find out that they could have learned from the start that there was an issue and then treated it appropriately. So the take home is, get yourself checked. If you have a male partner, get your male partner checked even before you start trying, so that you can enter it with peace of mind. And if there is a problem, then we can help fix it, or at least explore options of resolving the issue. All right, so plans to parenthood. So natural conception, obviously, having sex is one option. Intrauterine insemination, I've talked about it for a few moments, and that could be either with your own partner's sperm or with donor sperm, and we'll follow through every step of what all that entails. But what that means is that mature egg is there in your body, and we're just placing the sperm in the uterus so that those two can meet. So it's all still happening in your body, still happening sometimes with your natural cycle, sometimes with help with medication. But that's the whole process, so it's not as invasive. IVF we talked about. But there's other options. Maybe you are in your 40s and your ovarian reserve or egg count is completely diminished and you are not fertile anymore. Then we can use an egg donor. So we can take an egg from a younger woman, fertilize it with sperm, create an embryo, and then put it back in your uterus to grow. So that's one path to parenthood. Let's say you are in a same-sex female couple and you need a sperm donor in order to achieve a pregnancy. We can help with that through intrauterine insemination. And then sometimes, either because the woman herself has a condition that prevents her from being able to carry a pregnancy, or you're in a same-sex male relationship and we need donor egg and a carrier, so someone to actually carry the pregnancy. And so these are all things that we can explore with you one-on-one to help you better understand the process, the actual steps, the risks, the benefits, and even the cost. All right, so next steps for all of us is whether you are desperately trying to not get pregnant and you have no desire to be pregnant for another 10 years, or you have been trying to get pregnant for some time already, and maybe you've even suffered from miscarriages, or maybe you're in a relationship and getting ready to get engaged and just starting the conversation of wanting to have a child in this next year. Either way, regardless of where you are in your journey, I would encourage every single one of you to at least learn more about your body, learn about your fertile health, learn about your egg count if you're a woman, learn about your sperm count and semen analysis if you're a man. And a lot of times people think this is scary, like, oh my gosh, what if I find out something bad? And my take home from that is the worst that can happen is you find out that your egg count is low or your sperm count is low, and then hopefully we can do something about it to make it better. I would think that a worse option would be to find out that you have no options. And the key is the sooner you take action, the sooner you learn about your body, typically the more options we will have. And it's really not meant to be scary. And I hope that this discussion we've had so far kind of has taken away some of the fear behind it. So let's talk costs. So the assessment itself is going to typically be covered by your insurance, and we accept all the major insurances. But if you don't have insurance, then the price for those of you who are joining us today is 50% off, so it would be $150. But if you have insurance, then it's going to be just like a typical doctor's visit, so you may just have to pay your copay. But the maximum for those of you who are joining me today would be $150. And then egg freezing, typically our Kind Body price is $6,500 for the price of an egg freezing cycle. So for those of you joining us today, you'll get $1,000 off of that. So it'll be $5,500. And then IVF is also $1,000 off at $11,500. And so what I would encourage you to do is start with the assessment, okay, no strings attached, just learn more about your body. And then if you end up choosing to proceed with either egg freezing or an IVF cycle, we'll honor the discount. But can't do anything without learning more about your body. So use this discount code within by tomorrow night, so within the next 24 hours, but by tomorrow midnight, if you enter July 16 101 by going to our website, kindbody.com, and book an appointment to see us and enter that promo code, it'll automatically apply the discounts for your assessment, as well as if you end up doing any cycles with us. So hopefully you guys will take advantage of that, and we'll see you guys soon. We do accept all the major insurances. They're listed here for you. We also have payment plans. If you do have any specific questions about your insurance or copays, email us at navigator@kindbody.com. We love helping you guys with this. I can say as a patient and as a doctor that insurance stuff is frustrating, and we want to take that frustration off your plate. So let us know if you have any questions, but we do accept all these major insurance plans. So if you're coming to us for fertility or GYN, we're just like your regular doctor's office. You're not paying anything extra. So even if you just come to see us for your pap smear, your well woman checkup, your IUD, it's exactly the same as any traditional doctor's office. And that's it. So I'll open it up to questions and see what you guys have.
Amazing. Thank you, everybody. Thank you, Dr. Sasan. There's been a lot of great questions throughout, and we've been trying to get everything answered. I'm going to ask a few here, and if anything that you asked, or if you have any other questions that have not been answered, just leave them in the chat now, so we'll get them answered. One question we got is about age. What age is young enough to presume that you have good quality eggs?
Quality. So key things to understand the quality. So women generally in their 20s and 30s, it's safe to assume that the quality of your eggs are going to be good. Again, there's no test to check, but what we say is that at the age of 20, about 90% of our eggs are going to be genetically normal, and 10% will be genetically abnormal. By the time we reach 40, it flips. So in a 40-year-old, 10% of eggs are genetically normal, 90% are genetically abnormal, and it's just a slow decline. But certainly anyone in their 20s and early 30s can safely assume that the majority of your egg quality is going to be good. That's not the same guarantee with egg count, because that can vary. Unfortunately, there's some 30-year-olds who have poor egg count. So that's.
Thanks. And then a similar question on the other side. So at what age are you too old to, try naturally? What would you recommend in that scenario?
I'll go back to kind of my favorite statement. You're never too young or too old to learn your own facts. That part, I think you can't hypothesize or generalize. I think it's paramountly important to not assume you're fertile and to not assume you're infertile just based on your age. So I would encourage every woman, even if you're 20 or you're 45, to come and do your assessment so we can give you your own facts, because there's always people that break the rule. There's always going to be people that are outside of the normal averages. So it just becomes so important to do that assessment and not just guess or suppose that you're fine.
Thanks. We have a few questions about donors. What's the process like of using a sperm donor? When would you recommend that?
Yeah, so a sperm donor, two facets. So one is you could be single and you've made that incredibly empowered decision that you want to have a baby on your own, and so we need sperm. And in that case, then sperm donor, and I don't mean to trivialize this, but it really does become like going on Match.com for finding the donor of your choice. So sperm banks have really elaborate intake forms, and you can pick from every basic stuff like appearance to family history, genetic history, IQs, all that good stuff. And that process can take some time. So one could be for a woman who's choosing to have a baby on her own. And then it could also be for a same-sex female couple. And again, the process would be the same. And so the way that we help you navigate it is we'll tell you some of the more reputable sperm banks. What I mean by reputable is we want to refer you to sperm banks that do genetic screening, that we know do good testing, and that can really provide you a good sample. So we'll help you navigate that. We'll tell you exactly how much sperm to get, how many vials do you need, when do you need to order it, when does it need to be shipped. So we really take away all the questions off the table and help you understand every step of the way.
We have some questions about PCOS. Can you speak to what PCOS is and what impact that might have on fertility?
Sure. So PCOS stands for polycystic ovarian syndrome. If I had like one nerd wish, I would change the name because the name is very misleading. It makes people think they have a bunch of cysts, but that's not the case. So what polycystic ovarian syndrome is a spectrum of disease. It's not black and white, of a hormonal imbalance. And so that hormonal imbalance can create a dysfunction in ovulation. So remember my whole analogy where each month your body recruits a group of eggs and your brain sends a signal to help one egg fully mature. And this typically happens like a clock each month. You just go through the cycle. And a person with PCOS, they recruit the eggs each month, but there's not a correct communication so that none of their eggs fully mature. So no, they never ovulate, or they don't ovulate on a regular basis, and that prevents them from being able to conceive. Some women with PCOS ovulate, but they ovulate every like 50 days instead of 28 days. And then there's some women with PCOS that don't ovulate for a whole year. And that's where I said it's a spectrum of disease. So no two people with PCOS are going to be exactly the same. Really important if you've been given that diagnosis to come and see us and let us explore, because you may have been given that diagnosis when you were a teenager and you may have grown out of it. There's such a thing as growing out of PCOS. So really important to not just assume because someone told you a while ago you had it that you still do, and then important to peel the layers of the onion to truly understand how severe is your PCOS. Women with PCOS can still freeze eggs. Women with PCOS can still get pregnant naturally. Sometimes they need intrauterine insemination. Sometimes they need IVF. So it's a disease that you can't pigeonhole and really requires a one-on-one discussion to fully understand how it impacts you.
Thank you. And then we also have some questions about fibroids. Can you tell us more about that?
Sure. Kind of similarly, no two fibroids are created equal. Fibroid is a growth of the muscle or an overgrowth of the muscle of the uterus. So uterus is the womb, that's what carries the pregnancy. And fibroids tend to be round, and they can be really small, like the size of a pea, and they can grow really big, like bigger than a basketball. And some people can have just one solitary fibroid, and some people can have 40 fibroids. So it's really what varies in size, varies in position. So you could have a fibroid that's inside your uterus, outside your uterus. Some fibroids actually affect pregnancy. Some fibroids don't affect pregnancy at all. So the key thing with fibroids is doing an ultrasound or sonogram, seeing do you have a fibroid? If you do, where are they? How many are they? How big are they? And then based on the answers to those, we can tell you, is it going to impact your fertility or not? Can you get pregnant or not? Most fibroids are not going to impact the egg freezing process at all. And having a fibroid doesn't affect your egg count. Some fibroids do need to be removed before a pregnancy.
Thank you. We'll wrap it up in just a couple minutes. One question that we get a lot is if you can tell how much you can tell about your own fertility from your mother's fertility or your grandmother's fertility.
Yeah, not much. So I was talking earlier, you know, a lot of women will come to me and say like, oh, I'm fine. My mom had me when she was in her 40s. The thing to understand about fertility is it's multifactorial, right? It's not just egg, sperm, baby. Yes, egg and sperm are really important, but there's other factors that play a role. And so you can't just assume because your mom had a miscarriage that you'll have one, or because your mom had you when she was late that you will. But really important, the next time you're with the women in your family, is ask them, how old were you when you stopped getting your period? So your mom, aunt, grandmother's age when they achieved natural menopause can impact your fertility. And if they say they were less than 45, that should trigger you to say, oh, I need to go check my fertility, because that might mean that you're going to go through menopause early as well.
Amazing, thank you. So we're going to wrap up now. If anyone has questions that were not answered, you can email us at navigator@kindbody.com. We're also going to be sending out an email tomorrow morning with the code that we gave you at this event, as well as the recording, so you can go back and watch anything you miss on our YouTube channel. But with that, I'll say thank you, and I'll hand it back to Dr. Sasan to share any final words.
Yeah, I hope this was informative. I know this topic is a little taboo and scary for a lot of people. I hope this took away a little bit of that fear. And just my take-home message for all of you, again, regardless of where you are in your journey, is just take a moment and learn more about your body. Let's start with a consultation if you're not quite ready to come to the office. But if you are ready, then come in, let's do a consultation, have an honest discussion, learn about your egg count. And then from there, you'll have the options, and you can do with it as you please. But I just do encourage all of you guys to empower yourself with the information, and be well, stay healthy, and enjoy the summer.